Stat A. How to use atorvastatin should be taken either with food or without food as advised by your doctor. Take atorvastatin precisely as directed by your doctor. The dosage is determined by your health condition, age as well as your reaction to treatment. Swallow the tablet with water. Do not crush, chew, or break the tablet. Do not discontinue taking atorvastatin without first consulting your doctor. Expert advice. Take with or without meals. Take medicine at the same time each day. Contact prescriber if unrelieved diarrhea, watery stools, fever, unusual muscle cramps, weakness, mood changes, memory changes, yellowing of skin or eyes, easy bruising or bleeding or unusual fatigue, weakness. Take a missed dose as soon as you remember unless it is likely the time of next dose. Do not double the dose. Avoid high intake of grapefruit juice, 1 liter per day. Take sufficient amounts of fluids, 2-3 liters per day, unless restricted by the prescriber. Laboratory tests are important during therapy. Primary uses, hyperlipidemia, indications. This medicine is used as an adjunct to diet in hypercholesterolemia, high cholesterol, heterozygous, genetic disorder characterized with markedly increased LDL and cholesterol, and homozygous familial hypercholesterolemia, a condition in which it is difficult to remove bad cholesterol from body. Mixed hyperlipidemia, genetic disorder characterized with high lipids, fats, cholesterol, and free fatty acids in blood. Side effects: atorvastatin can cause GI upset, myalgia, muscle pain, arthralgia, pain in joints, headache, asthenia, abnormal weakness, insomnia, difficulty in sleeping, dizziness, Paraesthesia, abnormal sensation of skin such as tingling, burning, chilling, and numbness, hypoaesthesia, reduces sensation in one or more body parts, chest and back pain, pain extremities, epistaxis, bleeding from nose, muscle spasms, joint swelling, abnormal LFTs, raised creatinine kinase, ALT and CPK levels, hyperglycemia, high blood glucose, nasopharyngitis, swelling of nasal passages and back of throat, commonly known as cold, etc. Immune-mediated necrotizing myopathy, autoimmune muscle disease, relatively severe proximal weakness is also reported. Thanks for watching.